Welcome back to Sleep Better TV. I'm Tasia Custodi. I'm joined once again by Dr. Blake Perkins of Dental Sleep Medicine in Vancouver, Washington. Dr. Perkins, we've talked before about children in OSA and children and their sleeping habits, but what I want to discuss with you today is children and snoring. Is it ever normal for a child to snore?
Well, if you think about why snoring happens, then I would answer no, it's not. Because snoring happens when the airway is blocked for some reason, and tissue in the back of the throat is moving around, and that's where the sound of snoring happens. But the underlying cause is the fact that something is in the way of your breathing. And if that's happening, then it can't be good.
So how can it be treated, and why should it be treated when a child is snoring?
If your child is snoring, I would say the best thing to do is, first of all, see a physician and figure out whether the snoring is coming from enlarged adenoids or tonsils, whether there's a blockage in the nasal passages that's forcing them to breathe through their mouth while they sleep, or some other medical condition that is predisposing them to snore. Then go to the dentist and have them examine the dental situation, because a lot of times if the palate is not developing correctly, if the jaws aren't growing the way they're supposed to grow, then that can also affect the shape and size of the airway. Once that's done, then you can decide, well, do I need to approach this from an orthodontic standpoint and help grow the size of the oral cavity, or do I need to approach it from a surgical standpoint and remove tonsils or adenoids or something that's blocking the nasal passages?
So is this invasive for the child, or is it fairly standard?
The surgeries to remove the excess tissue, whether it be tonsils, adenoids, etc., are pretty standard procedures that are done in hospitals all over the country every day. And also the treatment for children orthodontically is also done all the time with palatal expanders or different appliances that can help to encourage a wider airway.
Thank you so much for your time today.
You're welcome.
My guest today has been Dr. Blake Perkins of Vancouver, Washington, and you've been watching Sleep Better TV.